Hello, everyone. There's a calm across the room. My name is Heather Aldersea, and I'm the Scientific Director for the ICA-CBR. And on behalf of Marcia Finlayson, I'd like to welcome you all to the second annual Malcolm Peat Lectureship. And I'd like to give a special welcome to Fiona and Gail, who have managed to attend today with us. And as well, a special welcome to all of Malcolm's friends and family who were able to attend as well. I see many of you in the room. So the Malcolm Peat Lectureship is a special fund set up by the family and friends of Dr. Malcolm Peat, and anyone's welcome to contribute to this fund in his memory. Dr. Peat was a physiotherapist by training, and he was the director of the School of Rehabilitation Therapy and the associate dean of the Faculty of Medicine from 1984 to 1997. And he was also the founder of the ICA-CBR, officially established in 1991. Many of us in the room have had our lives touched by Malcolm. He was a visionary and a mentor who was passionate about community-based rehabilitation and committed to building the next generation of rehabilitation providers. He had endless passion for ensuring that people with disabilities around the world had equal opportunities. I think he would be really interested in the topic of today's lecture, which is applying CBR, peer support, and empowerment principles to facilitate refugee integration in Canada. I'm delighted to introduce you to our speaker, Dr. Rochelle Thibeault. Dr. Thibeault is an occupational therapist who also holds a PhD in psychology. She specializes in CBR, psychological resilience, and peer support in vulnerable populations. Dr. Thibeault has worked with war and torture survivors, AIDS orphans, child soldiers, and people living with leprosy around the world. And for her work with these populations, she was awarded the title of the Officer of the Order of Canada in 2013, the Lifetime Achievement Award from the Canadian Society of International Health in 2015, and an honorary degree from the Faculty of Medicine at the University of British Columbia. Please join me in welcoming Dr. Thibeault.
Well, thank you, Heather. It's a real honor. It's a real pleasure to be with you today. And it's also a real honor to be here in the memory of Malcolm. I guess like many of you, Malcolm was a mentor for me, and he was always so kind and open with his wisdom, his advice, and he really has shaped my career. So I'm really thankful for him touching my life. What are we going to do this afternoon? It's going to look at a project that was started in Ottawa in 2016. And just to give you a little bit of a background, it was mandated by the City of Ottawa when it was announced that we would receive about 2,000 refugees. The City of Ottawa reached out and asked if we could really develop some community-based strategies to really facilitate the integration. And with other partners, we actually created a special CBR program for the newcomers. So we received approximately 2,000 government-sponsored refugees since December 2015. And initially, they were housed in something called Reception House and 2 hotels. It didn't go so well, in fact, because the conditions were really overcrowded. Some groups were actually fragmented. People who wanted to be with each other ended up being in different locations. Transportation wasn't really good between the locations. So there were quite a few logistic problems initially. And when we did the community consultation with the refugees, there were a lot of issues around the slow processing, physical and mental health, lack of housing, lack of employment. And so they really fit in many ways the main findings that one would find in the literature the world over. What we also touched upon was the settlement workers who were totally overwhelmed. When the pace of arrivals was decided, it wasn't in consultation with the settlement workers. So they were at the receiving end, and quite quickly they really had the feeling, and I'm quoting some of them, they were drowning. So for us, within the CBR program, it was really key to make sure that they would also be taken into account. And again, I think it really reflects Malcolm's philosophy that CBR is something very systemic. Yes, you want to embed a program, but it fits into a greater society, and we need to take that into account. So what were the main needs? High levels of anxiety, depression, PTSD, isolation, disrupted routines, and again, lack of housing and employment. So after consulting with different agencies at the provincial, at the municipal, and the local level, we decided to obviously go with CBR, but we decided to use a CBR component that sometimes is left aside. We all know that in the CBR literature, peer support is there. But quite often we will set up CBR programs without relying on peer support. In a context where obviously the instigators of the programs didn't speak any Arabic, where we didn't know the culture, because of the huge gap between the newcomers, culturally, and Ottawa, we found that the best possible option was again to highlight that peer support component within CBR. So, as I mentioned, it's a key strategy in CBR, and has always been. And for us, what we did before launching in that peer support component, we did extensive community consultation within the Syrian community in Ottawa, within the Arabic-speaking community, and with, obviously, the refugees themselves. We really wanted to make sure that whatever we would come up with would reflect the cultural needs also of the people, of the users. And obviously, also throughout the process, we had Syrian refugees being part of the team and giving their feedback and helping us to gear it in the right direction. So what's exactly a peer supporter? Again, we don't see it very often in CBR programs. They are people with a lived experience around certain situations. It could be a health condition, immigration, war, and maybe they haven't resolved all the associated issues, but they are stable enough to be able to provide support to others facing the same situation. In situations where the vulnerable population cannot necessarily speak for itself, in the case of children or people with disabilities severe to the point where they cannot speak for themselves, it could be family members or loved ones who will be the peer supporters. But in the context that we had in Ottawa, the peer supporters had to be people who knew about immigration, who knew what it meant to be uprooted, and people obviously who also the same shared experience around cultural values. So the objectives of the program first was for the refugees to be familiar with and use the institutions and facilities that shape daily life in Ottawa. To know where you get your OC Transpo card, to know how you use the banking system, all those things that really might make life possible. So one of the roles became what we called a peer navigator. So we wanted our peer supporters to be able to help the newcomers navigate daily life in Ottawa. The second objective was to really screen early for disabilities and mental health issues. Because what the literature says is that more often than not, people go through war experiences, they are displaced, and it's only years later that eventually they get help for conditions that could have been prevented from becoming chronic, and especially around mental health issues. So we really wanted the peer supporters to be able to identify within the community people who might need help. And so we wanted them to become peer screeners. The main role of a peer supporter is usually to provide emotional support, so clearly it also remained a clear role for the people we wanted to train, so that it would accompany the Syrian refugees from the day pretty much they arrived and until their integration, and as we will see sometimes way beyond that. And the last role is really the one of peer networkers, because we wanted these people to connect the refugees really quickly to local communities and resources, to use, in fact, their own network already established and to share it with other people. So what we had in mind was to have those individuals who knew the culture, who knew the traditions, who knew the language, who could play 4 key roles with the Syrian refugees. So what was the administrative structure? An agency had been created in Ottawa, specifically around the needs of Syrian refugees initially, and it expanded to other communities, and it's called Refugee 613. They created a mental health subcommittee, and through a local NGO, the Ottawa Community Immigration Services Organization, we were attached to the mental health subcommittee, and we designed an 8-month-long project that started in May 2016. And the funding came through the Ottawa Community Foundation. So what was the process? The first, obviously, was to do a thorough needs assessment. As you know, in CBR, the first principle is to acknowledge one's ignorance, ignorance of the context of the needs, and so that's what we did. We didn't assume that we knew anything and started with a blank slate. And again, when I wrote in boundaries, we wanted to make sure in that needs assessment that we looked at the Syrian refugees, but that we also looked at all the people whose lives would be impacted by the program. And it's really key to make sure that the program gets well accepted within Ottawa, within the community. And so what we looked at was how will the program impact, for example, the education system? Will there be any overlap? Will there be any overlap with the medical system? And will there be any overlap with the settlement workers? And just to give an example of what happened with the settlement workers, when we connected with them, they saw us as a threat because no one had talked to them. So what they immediately read into the whole thing was, someone is moving into this place and is going to take over my job. And so immediately the way they decoded the whole thing was, the peer supporters will replace us. And it is exactly the kind of data we need to make sure we don't create conflict when we move into a new area. And so we were able to, in fact, reassure the settlement workers and tell them from day one, listen guys, what we're going to do, we're going to be there to help you. You feel overwhelmed, you're running ragged. Is there anything you can, in fact, pass on to the peer supporters? Could there be people who would alleviate your burden? And so we managed, in fact, to create alliances, partnerships that were positive for everyone. The settlement workers came quickly on board, and you will see the results eventually. Then we had obviously to select the participants, do the training. Then it's that step of matching participants with refugees and doing an ongoing monitoring of the activities and doing a community of practice, which we kept only during the pilot phase, and I will speak about it more, and obviously the monitoring and evaluation throughout. More and more, what's recommended in CBR is not to wait until the end of a project to do our monitoring and evaluation activities, but we really do them from day one. From inception, there will be some strategies of monitoring and evaluation. So we started small, And we were overwhelmed with the response we got from the Arabic-speaking community in Ottawa. So we put ads everywhere in mosques, in community centers, in the media about the program and saying, you know, would some of you would be willing to help the Syrian refugees? So 300 people showed up, and amongst them, we selected 20. So we were very fortunate. It was really heartwarming to see the reaction of the local community. They underwent a 12-hour long training program, and we will look at it more closely. And I want to speak, before I get into the training program, I want to speak about the community consultations that we did with the refugees themselves. We used a methodology called Social Analysis Systems 2, and it's a methodology that's designed to make sure that whatever we do is going to be participatory and democratic. We want to make sure that no one's left out, all voices are heard, and that no one feels threatened or excluded. And by the way, all this is on the web for free. They offer really neat tools. Now they've got about 50 of them on the web that can be downloaded, and they are really great tools for community consultation. And they come from Participatory Action Research framework. And just an example, when we wanted to do kind of a mental health assessment, Syrian refugees come from a culture where you don't speak about mental health. Lots of taboos around, like in many cultures, they're far from being the only ones. And so what we designed, and again, it's all SAS inspired, just a thermometer with, you know, wellness and, you know, sad mood. And so people would actually write on on Post-its, where they felt they stood on that thermometer. Everything was perfectly confidential. They would write their sticky note and they would put it face down. So we wouldn't know who had answered. But it certainly gave us a really good idea of how people felt in a totally non-threatening way. And so what we found is that most participants were really under 5 in terms of their sense of well-being and emotional state. So we knew that if one of the roles of the peer supporters was to help with emotional needs, we were bang on, because it really coincided with the data we were collecting. So what we found with the consultation is that people coming to Canada found there were lots of very positive things. I mean, the new feeling of safety and freedom, the respect with people from all ages and backgrounds, equality and human rights. As a whole, they found that people were kind, that they were well received by Canadians. They were really taken by beautiful landscapes, although some of them came in wintertime, so I thought it was very, very generous of them. They were really impressed with the free and strong education system, medical care, good transit system. On the other hand, what they liked not so much was, and that was a major issue, was sexual education for children in schools. And the way we got these answers, we asked them, are there things in Canada that you dislike so much that you choose to go back to Syria? And the one that came up loud and clear was, in fact, sexual education of children. It was the only issue that we came across that was unanimous in the group. And we didn't see that coming, but again, in good CBR fashion, it's simply to observe and embrace what is and try to work with whatever surfaces. What they found very difficult was to find work and having their qualifications recognized. They were really keen, obviously, on bringing family from Syria and other countries. Their financial situation was dire. They had psychological difficulties. There was a lot of homesickness. Quite a few, in fact, came alone and had difficulty connecting connecting even within the refugee community. They realized that there were some significant differences between their society at home and Canadian society, and they could foresee some difficulties adapting, language difficulties, translation, and obviously the sense of a very uncertain future for them and their children. And something also that I need to qualify, when we do this, when we ask about things that they find really painful or difficult, we always follow it by a statement saying, you will say things that we may not have any power over. We really have to manage expectations from the very beginning and tell them, okay, we will try to see what is difficult for you. We will make the list, and then we will try to decide what we can work on, what we can't, and if we can't, where we should go to have those issues addressed. But we make it very clear that we're not going to tackle all of this because trust would be broken at the very beginning. So that's always said very clearly. And so the challenges when we tried to look at the role of the peer supporters, so they were challenges that could be addressed directly by a peer support worker, so helping with social connections, adaptation, again, navigating the society, the city, planning for the future. So some of the roles could be taken on by the peer supporters. There's kind of an overlapping area with the referral systems. They could tackle some psychological difficulties, obviously not when it fell into the real pathology, but some more, lighter difficulties. They could deal with language difficulties, and they could act as translators, interpreters. And the things that very early on we indicated we couldn't do as part of the program was the question of the sexual education of children in schools. So a peer supporter explained how in Canada this has to go through democratic process, and it was through discussions with the school system agents that they could maybe make their voice heard, but it wasn't part of our program. Finding work, that certainly not was one of the issues we could deal with. Bringing family from Syria was out of our realm, and same thing with financial situation. And in a context like that too, when we train the peer supporters, something that we stress very strongly, they should never give money, ever, to the person they're going to be supporting. Because what you see if you wear two hats, if you're the person assisting, the kind of friend who can be there for you, and suddenly they cannot repay a loan, again, trust will be broken, and sometimes the peer supporters were the only connector between the refugee and Canadian society. You don't want to jeopardize that with money issues. So it was made clear from the very beginning, no financial transactions between the peer supporters and the refugees. The training that we did was built upon the results of thorough needs assessments. And again, we contacted the community centers, mosques, anthropologists, the Syrian refugees themselves, a really broad base. I was founding director of an organization that's called Peer Support Canada. And within Peer Support Canada, we created a training program. So we drew from some of that training program. And from that, I already created one that I had tested in places in the Middle East, Europe, and Africa. So it was a bit of a melting pot. So stuff from Peer Support Canada, existing peer support programs, and we tweaked it with the data that we got from Ottawa. And once we got all this done, we had a general meeting with, and settlement workers had provided some, we had a general meeting with settlement workers, with representatives from the Syrian community in Ottawa, representatives from the Syrian refugee community, to make sure that the program met the needs and respected the culture. So we really wanted to have a lot of checks and balances along the way to make sure that we would remain within an adequate cultural framework. So for the training that lasted about 12 hours, for the peer navigator, we went to rehab and medical departments in Ottawa, City Hall, federal and provincial agencies, banks, I mean, you name it, community centers, so that the peer navigators themselves knew a whole lot better about their own city and then could become guides for the Syrian refugees. Initially, we had people who had never taken the public transit. So we said, if you're going to help out refugees, well, that's part of the learning curve. So with the peer supporters, we identified the areas where they themselves needed some knowledge if they wanted to be good guides for the Syrian refugees. They got a very brief mental health training designed to try to spot the more obvious cases of psychological distress. And then obviously we put in place a whole structure to try to bring these people forth so they could get treatment while respecting cultures and traditions. And then the peer supporters also got training on resilience and psychological self-care, because we wanted them to be able to help someone in distress, but also be well aware of the healthy boundaries they needed to maintain so that they wouldn't get drawn into that distress. We wanted to make sure they would remain healthy, comfortable in that whole process. And we gave them also a brief training on community networking and mobilization to know how to really kind of mobilize people around the Syrian refugees they were accompanying, if they needed some special services, to make sure that the peer supporters knew how to mobilize the resources in question. So who were the trainers? So we were all volunteers, by the way, initially. And so there was, except the program coordinator, at the level of the NGO, OCISO, and the program coordinator was himself a Syrian refugee who had arrived earlier, had adapted well, and he was a psychotherapist in Syria. So he became the head of the CBR program. We were a group of volunteers from the University of Ottawa and other agencies who wanted to pitch in. And all together, we provided the peer support training. And the settlement workers also took part quite extensively. Imams were approached but did not participate, because when we did an in-depth analysis of the group we were working with, the initial group, we realized that there were people from different faiths. And we didn't want to create a bias, let's say having an imam from a certain group when we wouldn't have an imam or a priest for other groups. So after much discussion, we decided to go for religious neutrality, but what we did, we informed the different communities about the program, and if people wanted to connect, I mean imams or priests, everything was obviously fine. And settlement workers were also trainers. What we did initially with our the first group of peer supporters, we really wanted to create a community of practice. We couldn't be on 24/7, and we knew that they might get into some difficulties, a few glitches here and there. So we created a web-based or a phone-based system where they could call upon other peer supporters for help so that they wouldn't feel isolated in their role as peer supporter, and could really draw from other people's experiences if there was a glitch somewhere along the way. And obviously, there were regular meetings with the coordinator, who was, again, a psychotherapist, who really helped them to find the right boundaries in their interventions. And so that step, though, the OCISO representative was actually the Syrian psychotherapist I was telling you about. But we kept this only in the pilot phase because when the program grew, people felt they didn't need it as much anymore. So what happened with all this? As I mentioned, for us it was really important to monitor the whole thing quite closely. So again, from day one, we implemented a monitoring, evaluation, and learning structure. It was based on the what's called empowerment evaluation, and it's a researcher called Fetterman who created that framework, because we wanted a form of evaluation that wasn't seen as being punitive. And in Fetterman's perspective, when you provide data, it's in fact in that vision that you're going to build on it. It's not really with that vision that you need to chastise people, or because we knew that the peer supporters, it's very difficult to keep volunteers. They were all volunteers. And if you bring negativity into a volunteering situation, you lose your players. So it was really key to frame the whole thing around empowerment. And that MEL process was designed, again, to be just a regular feature of the program. What it yields is really quantitative and qualitative measures that are going to indicate us if what's beneficial for the peers and the peer supporters. We really wanted, again, to monitor the peer supporters' well-being, making sure that they would remain as volunteers, that if they felt that it was too much for them, if they felt they were not recognized, and the data on volunteer work is really clear, you need regular reinforcement systems to maintain your volunteers in that role. So that's what the monitoring and evaluation MEL system we designed. And I want to mention how it was designed, because I created this in 2010 with a colleague from the Center for Disease Control in Atlanta. At one point, I was really fortunate. I was called in at the CDC to train their workers, not on CBR, had nothing to do with CBR, but on psychological resilience. Their staff, they were burning out right, left, and center. So they asked me to go and work with them on psychological resilience issues. And they have the biggest health monitoring structure in the world. Just for health monitoring indicators, they've got about 3,000 people working on the topic. So I negotiated with them. I said, I don't want to be paid for my work, but I want access to your evaluation unit. And so they agreed, and they paired me with one of their main researchers around participatory, really down in the field evaluation. And together we co-created this system. As you can see, we opted for 4 kinds of indicators. The first ones are called engagement indicators. And I guess I should have chosen another color because we don't see it well. But what's written in orange is, how do we know that what we are doing meets your needs and that you're going to get on board? Before launching in a big way, we wanted to know that what had been designed would fit the bill. And so the engagement indicators are really, you have, again, quantitative and qualitative indicators. They tell us that people are on board. So you do that early on, and you ask people to generate their own indicators. Goldie, my colleague, and I never generated any indicators. It's the people themselves who tell us what makes sense. So we asked the refugees, I said, how would we know that what we plan really appeals to you? And they say, it will be the number of times we take part in activities. If we show up, it's good. If we don't, not so good. We asked the peer supporters, they said, if we maintain the time that we are in contact with the refugees, and if we increase it, it's going to tell you that, yes, we're really enthusiastic about this, and we'll keep going. The settlement workers, they said, it will be the number of tasks we will be willing to devolve to the peer supporters. If we have a feeling that these guys do their job well, that we can rely on them, then we will start delegating. And that's going to be our indicator. And we had several funders, and it would be, for them it was in terms of money. They would say, well, you know, if it works well, we will extend the funding by so many months. So once we had the engagement and indicators in place, we knew, okay, so the people, pretty much all our players are well engaged. We make sure that they remain well engaged, so we use process indicators. And basically, they are indicators. It's what they want to see so that they remain engaged. And so when we ask refugees, you know, what would be important for you to remain within this project, what do you really want to see? And they said, you know, we want faster responses. They felt that sometimes they would call a peer supporter, the person wouldn't reply immediately, so they identified what they needed. We want faster responses. If we get that, we're good to go. Peer supporters immediately identified, they said, we need more funds, and mostly for travel, to go meet their the peers, the refugees, and travel around town. So they said more money would be good. Settlement workers, they said what we need to remain engaged, if we devolve activities, some tasks to the peer supporters, we want timely feedback. So let's establish a structure where automatically we'll get the feedback from the ground. And the funders obviously wanted regular reports to be able to plan. And then in terms of outcomes, as you can see, we wanted to capture expected outcomes and unexpected outcomes, because we all know that although we start with a vision, often stuff happens that we hadn't foreseen, and we wanted to capture that. So, and the expected outcomes, the question is very simple, is with this program, what would define success for you? I mean, what would it mean for that program to be successful from your perspective? And so the refugees said we want more outings around the city. We would want more information. We would want information. We would want comfort, physical and psychological. And they said we would want jobs. And again, we came back and said, jobs we cannot provide, so you kind of rectify things. But you said, the expected outcomes we'd like to see, we should be able to deliver. For the peer supporters, their expected outcome was really the number of refugee issues they would have resolved. They derived a great deal of satisfaction from resolving issues, and they said, the more we do it, the more stimulating it is, and that was their indicator. For the settlement workers, obviously it was the number of refugees settled. We wouldn't call, and when they mean settled, it's not necessarily in the sense of having a place to live, but settled psychologically, who wouldn't be constantly coming back to the settlement workers with issues. And for the funders, it was the number of refugees that were fairly settled and active. And then we looked at the unexpected outcomes, which is, is there anything that happened that we hadn't planned for? And what happened was a number of co-ventures that happened between the refugees and the peer supporters, not during the duration of the program, but afterwards they kept in touch, and some started some businesses together. Some started doing spend leisure time together, go to the movies together, do some sports together, learn to swim beyond the actual program. What the peer supporters reported, and we had actually administered some basic scales of psychological well-being, they felt a whole lot better about themselves. So it improved their own mental health. The settlement workers reported a much better quality of life at work. I mean, it had relieved some of the burden. And the funders, what they saw was really new connections between communities. So none of these indicators were things we were shooting for initially, but they still happened. And it's important to capture them, because when you go to phase 2 and you start writing up your grant proposals for more money, the unexpected outcomes are a fantastic leverage, because you go in and say, we've already achieved this, so we know the ripple effect of the program, and funders are much more likely to jump in. And so this is just one sheet that explains to you a little bit how we went about the assessing their indicators, the sense of hope and positive outlook, client's sense of control over his or her life, language abilities, knowledge of the city, positive behavior. They were all very, very simple, basic scales, often done with pictograms, and so we could see how things started changing over time, gradually. And we would do these things. They took just a few minutes, and we would do them regularly during the duration of the program. So what were the main challenges? There were lots of challenges in terms of logistics and stuff that's really down to earth. Again, transportation. How do you connect the peer supporter with the Syrian refugee? Traveling around town in wintertime. Several had disabilities, paratranspo, and so some of the logistics were complicated. The second challenge had to do with the diversity. It was far from being a homogeneous group. And just to go back also, when we did the community consultation with the refugees themselves and asked them, who would you like to accompany you in your journey? Would you like other Syrians to accompany you in your journey? The answer was a resounding no. And again, we hadn't seen that coming, but it made a lot of sense. They said, if you connect us with someone who's Syrian, we don't know which political allegiance they have. We don't know which religious allegiance they have. We don't know which linguistic allegiance they have. And they said all of this is often so taboo within Syrian society because of the really high level of tension. People don't disclose. They said you can make a major mistake and connect to enemies. So they said, if you want to do us a favor, go find Arabic-speaking people, but not within the Syrian community. And it worked fine, except that it created a cultural diversity that was a bit more difficult to manage. But again, we were hugely grateful for the people to have been candid and explained to us the nature of things, which we didn't know. And in terms of trying to do research, I was working at the University of Ottawa at the time, and our ethics committee didn't accept participatory reaction research. It was a format of research that was deemed unethical because in the view of the committee, you're not allowed to talk to your subjects before you write a proposal. And so the idea that we're all partners in a research project hadn't reached the committee yet. Let's leave it at that. So that's the reason why we were all volunteers. We couldn't have official research, although we went through ethics at the level of the local NGO. So we did everything ethically, but couldn't go through ethics. So what's happened since? There's a new program. I mean, this program has been growing. So there's a program that's been created for immigrant women that goes beyond just Syrian refugees. There's one in the making for youth at risk. And what we know is that eventually those programs will need to have a greater focus on grief and bereavement. And we would like to publish a step-by-step manual on how all of this actually came into being. And I wanted also to end on something that's been very helpful to us. It's really the importance of visibility. And we made sure that we connected with local CBC, local radio stations, to make sure that the program would be well known. And for two reasons, because it allowed some of the Syrian refugees that somehow had fallen through the cracks to reconnect, to find us and come and reconnect. It allowed a lot of people within the Arabic-speaking community, again, to come and offer help. And quite a few chose not to be peer supporters, but they really chose to provide other kinds of help. They would say, well, I'm not willing to take on the full shebang, but if people need transportation, I will be there for them. If they need to go to medical appointments, I will be there for them. We had some who said, that one of the main challenges for them when they came to Canada was to understand the school system and get the kids registered. So they said, if you need us for just this, we're there. And so publicity has been really an important step in this whole program. And so, in closing, I simply wanted to reiterate how Malcolm's influence in my life and in the life of so many others actually keeps reverberating through the world. I think I speak for myself and many of my colleagues who feel that the work we can do today, the people we can help today, we can do that in large part because of Malcolm's influence. Thank you.
Thank you so much, Rochelle. That was really inspiring and interesting. And I know I lecture in the OT and the PT classes, and we always inevitably have a debate around, can we do CBR in Canada? And what can CBR look like in Canada? And I'm going to take your example and use it in the future when I talk about CBR to our own clinical students here in Canada. But thank you very much. I'd like to open it up now for questions. I'll run around with the microphone, so if you just want to raise your hand and I'll come over to you.
Thank you very much for the wonderful lecture, and I can say that I'm so excited about what you are doing. I know how helpful it can be. My question is about when the program is finishing, how do you cut the cord? Because it's very hard. And do you want, I know that the fund would not be there, this big support is not there. How easy it is for people for getting disconnected and go with their life?
It's an excellent question. It's really a moment when that time comes. It's really a moment where we look a lot into self-care, and for both sides, for the peer supporters and for the peers, how they're going to manage without that connection. Something that we've seen, obviously, we let people free to continue the relationship if they want to, and quite a few relationships have continued. So they morph into something different. Peer support is not meant to be friendship, but life happens, and some of those relationships have become friendships which continue after the program. And for the programs, I'm no longer connected with OCISO. I've moved to other things, but there's a team now doing that CBR and peer support. And now what they're going to be implementing is really a meeting to see where people, at the end of the program, and identify resources where people can go and other people they can turn to make sure that nobody's left hanging at the end of the program.
Other questions?
Thank you, that was wonderful. I'm just wondering if you could give us an idea of volume. So you had 20 peer supporters, but how many support workers, how many Syrian refugees, what was the volume, how many volunteers working?
We had 20 peer supporters initially who actually accompanied about 30 refugees. And because we also gave them the choice if they wanted to accompany one person or two. And eventually some ended up taking on a whole family. So at the end of the program, I would say that we must have had about 60 refugees in the connected, oh no, more than that. I would say there are about 100 refugees connected to that small group of volunteers. And I don't have the latest numbers because that was the pilot phase that we did. And when I last went to CISO, which was in the spring, they said that they had many more volunteers, but the local agency hasn't been as rigorous in terms of keeping numbers. But they told me that in their estimate, there would be about between 500 and 600 refugees being accompanied through the program.
That's wonderful. Thank you.
Other questions for Rochelle?
Yeah, and I just echo everyone's thanks for the presentation because it was so great. And I'm just kind of curious, because you based the whole program on the connection with the Syrian people coming, I'm wondering about people from other cultures or other countries. Like, presumably you had many more people, refugees that came from other countries other than Syria, and whether there are any parallel programs going on for them, or if you see like what you think would be necessary to then take some of the lessons learned and apply them to other populations coming into the Ottawa community.
In fact, I didn't cover it, but what happened in the program initially, it was open only to Syrian refugees for funding reasons. Funders were very specific that the money should go there exclusively. And as a rule, it's not a good methodology. Any program where the label is too narrow brings with it exclusion. And exclusion brings with it conflict. So we were reluctant to go with just the Syrian refugee label, but the funders wouldn't do otherwise. But as the program unfolded, they realized that other people also needed help. So in the end, the final program, we had people from Jordan, we had people from Iraq, we had people from Egypt, we had people from way beyond Syria that ended up being part of the program too. Yeah.
And the same kind of premises worked for those, like they had the
Yep.
same fears and the same kinds of issues.
Yeah, yeah,
Yeah, interesting.
yeah.
I think we have a couple minutes for any more questions, if there are any.
I have hundreds of questions, but I leave them for later. Did anyone drop out of the program, like support worker, the volunteers? Did anyone drop out? And if they did, why?
We had two dropping out who were eventually replaced. And the two dropping out dropped out because they couldn't tolerate the suffering they saw. And they felt that their own mental health was at risk. And it's a message that we had given from the start, telling people, if you feel that it's starting to affect your own life, come to us. And if dropping out is the way to do it, Because what we wanted to prevent was people dropping out and leaving the refugee hanging. So we much preferred people coming forward, and so that we could find someone else. But 2 did drop out. Yeah.
I have a question. I was curious, you had such interest with the 300 applicants to be volunteers. How on earth did you select the 20 that you actually did?
We actually started, again, I didn't have time to go in all the details, but when we met with the Syrian refugees, we asked them very specifically, they said, can you describe the ideal person, what the ideal person would be for you to accompany you? Man, woman, age group, education, length of time in Canada. So the refugees themselves created the profiles they wanted to have. And so it helped us to really narrow down from that bank of 300.
Well, seeing no more hands, please join me one more time in thanking Dr. Thibeault for coming to the